Okay, so let's unbox the dental materials that I have got today. So it's a very nice packaging, as you can see. This is the bubble wrap. Okay, let's see. First thing that I have got. Okay, it is the cartridge. Okay, this is the cartridge for the local anesthesia. It contains lignocaine and adrenaline. So all the dental surgeons, you will be knowing that this adrenaline, it is a vasoconstrictor. So if you are injecting it, you will also get a blood free surgical field. And lignocaine is a local anesthetic, and it's the most widely used local anesthetic for the dental anesthesia. So over here, its ratio is 1 is to 80,000 adrenaline, and 2% lignocaine is present over there. So this is from the Vishal Dental Care which I have got. This I'm getting for the first time. Let's see whether I get any sort of special response, like allergic response or not. Next, I have got this one. Okay, this is from Septodont. This is the needle which I have got over here. It's a 30 gauge needle, 25 inch. So you will know that this is like where we use 30 gauge and 25-inch needle. This is primarily we use for the maxillary anesthesia. And okay, this is again a benzocaine gel. You know, benzocaine is the topical anesthesia. So the primary difference between benzocaine and lignocaine is, let's have a discussion. So when we talk about this so the difference between this lignocaine, as I was discussing here, and benzocaine is lignocaine. It works by blocking the sodium ion channels and hence stops the depolarization. Whereas benzocaine usually doesn't do that. Benzocaine follows the most likely the membrane expansion theory. So it expands the membrane in such a way that the ion channels which are present, they automatically get squeezed. Like, you know, if the membrane which is present, like this benzocaine, it is going to go into the lipid portion, the hydrophobic area. And once it gets into the hydrophobic area, after that, naturally, if you remember the phospholipid bilayer, and centrally there is a like this lignocaine, or sorry, benzocaine present over there. So it is going to make the membrane swell up. So if the membrane, you know, it swells up, so naturally the ion channels, they are not going to maintain its proper configuration and they're going to squeeze, and this will prevent the ions to enter in. So that's the way benzocaine works. So we primarily use it for the topical anesthesia purpose. Okay, then oh my god, this is very interesting. This is from Dentsply, and this is dical. So as you can see, it's calcium hydroxide. Good part is it is radio opaque, so if you shoot a X-ray, you can actually see it. Now, what is this calcium hydroxide? Calcium hydroxide has got loads of function in dentistry because you know, it's a very nice disinfectant. And here, like dical, primarily we use it for the indirect pulp capping, direct pulp capping. You just need to make it react a little bit with the blood of the pulp, and you will see that there is reparative dentin formation within 1 to 4 weeks. And that's pretty nice. Once a reparative dentin layer forms, then instead of going for a root canal, you can go for a regular restorative treatment. You can restore the tooth with anything like GIC or the resin cements. So you can, like the composite resin, so it comes up in two paste. So there is a base and there is a accelerator. If you want to know in detail about this dental material, it's not worthy talking in this short video. You can let me know and we can have a detailed discussion on this. Well, this is a developer solution. I hope everybody knows developer solution again has its own composition with hydroquinone and all. And this is not only a fixer but also a hardener. Actually, fixer contains a hardener in it. So this is it. These are solutions. I do not use the the powder form because it's a little bit messy. You have to make it, you have to sort of cook it. This is ready made and I use it a lot, so it gets used up. But definitely do not leave these things in open air, because once they come in contact with air, so it's pretty bad. They get oxidized and you won't be able to use it much. This is not a big deal. It's just a Dappen dish which I got. Okay, and so it's from Cottison. It's a silicone Dappen dish, and I think this is supposed to be autoclavable because it's made up of silicone. I'll see to it and I'll come back to you with the review whether it can be autoclaved or not. So that's it about these dental materials. Any of these dental materials you want me to discuss in detail, you can let me know in the comment section. We can have a video for each of them separately. Okay, till then, bye bye, Jai Hind.